Toxoplasmosis is a disease that results from infection with the Toxoplasma gondii parasite. This organism is one of the world's most common parasites. Toxoplasmosis may cause flu-like symptoms in some people, but most people affected never develop signs and symptoms. For infants, pollen-infected mothers, and for people with weakened immune systems, toxoplasmosis can cause extremely serious complications.
Toxoplasmosis is an infection caused by a parasite which is found mainly in cat feces and some undercooked meats. Most of the UK population will have acquired a natural immunity to this parasite in the course of their lives. But if a woman is infected during pregnancy, the effects can be extremely harmful to her unborn baby. The infection can cause miscarriage and premature birth in the first and second trimester. And if the baby survives, it may have mental retardation. Women should be especially careful when handling used cat litter, and if possible, ask someone else to do this job whilst pregnant. Whilst gardening, always wear gloves and wash your hands afterwards. Always cook meats thoroughly and wash all your vegetables. If you follow these simple guidelines, you and your unborn baby should be fine.
Retina. This refers to an inflammatory and exudative condition of the cornea of the retina. It was the most often response to an infection which may be generalized and involve several organs, or it may be limited to the eye. There may be various involvement, so giving rise to posterior uveitis. It may be congenital or acquired, at any age, particularly in the immunocompromised, where it may be occur manifestations to severe systemic disease. Symptoms: body anxious, swollen lymph nodes, headache, fever, fatigue, occasionally a sore throat.
Lens that matters, it's the retina. On the retina, the white spot with blood vessels emerging is the optic nerve. This carries the visual signals to the brain. But the part of the eye that does most of the work is that small dark circular area in the middle of the picture. It's called the macula, and it's only about 1 to 2 millimeters across. Right in the middle of that area, it's best seen in a green light, is a small pit with a yellow spot in the middle. It's called the fovea. This is what gives us a focused image. Every time we look at something and see it in sharp focus, it's not the rest of the retina that's doing it, it's just that small spot, only 1/5 of a millimeter across, that gives us that focused image. But because it's so small, what it sees in focus is only a small part of the scene in front of us. So the way we view something like this is to move the eyes around, seeing one small focused area after another. The brain receives these images and persuades us that everything in front of us is in focus. But it's an illusion. As we get older, our brain has to do more and more work. When we're children, the lens in our eye has a very pale blue colour. By middle age, in many people, the coloration is getting stronger. It's going yellow. And by old age, it can even be brown. But at all stages, the brain corrects and takes up that coloration so that we're totally unaware of it.
Thank you.